Welcome back. New South Wales authorities have ruled out implementing new COVID restrictions despite reporting a rise in cases of the new subvariant. Experts are warning to expect an increase in cases over the next month as the BA.2 variant becomes the dominant strain. Joining us live is Catherine Bennett, Epidemiology Chair at Deakin University. Catherine, we always appreciate your time. Thank you. What do we know about the subvariant so far?
Well, we know it is more transmissible, but actually we can learn a lot from what happened overseas. Denmark saw this BA.2 sublineage variant actually dominate whilst they're in the middle of that first big peak with Omicron. So we do know what to look out for. It, like the BA.1 variant that we mainly saw here, it doesn't translate to hospitalisations in the same rate. So that's the good news. That's telling us a bit about the virus, but also a lot about our vaccination coverage. And as more people get the booster, that not only reduces that risk even further of hospitalisation, it also helps to reduce that risk of symptomatic infection. So that can help keep it in check.
Just to clarify, though, is there any difference in the vaccination efficacy, do we know, between those variants or not?
Well, it looks pretty similar. We do know, though, that BA.2 is that bit more transmissible. So it's still going to lead to transmission in the community. It's probably contributing to those numbers rising, not just in New South Wales, but places like Victoria as well. But where we have had worse weather, so New South Wales, forcing people indoors with that more regular rainfall, for example, it's pushed the case numbers up even higher. But thankfully, we're only seeing a marginal shift in hospitalisations, and that is mainly limited to the people coming into hospital. And so some of that will be incidental infection as the rate of infection in the community pushes up. Doesn't necessarily mean people are there for COVID itself, and in fact the numbers in ICU are still relatively stable. They are, we've got 19 people on ventilator, we had 14 a week ago. We don't want to see those numbers go up because that tells us that the serious illness cases are rising. So boosters, particularly in the vulnerable people, are really important to help protect people from ending up in hospital with the infection. But we do have to adjust to that risk of seeing cases when you do go out and mix in public. The risk has just gone up because we know the infection rate has pushed up more broadly in the community that little bit, and this new variant is believed to be between 30 and 40% more infectious than BA.1. So all our efforts still matter, but even with that, we will see numbers go up a bit.
Catherine, it wasn't that long ago that in every news bulletin we were reporting the vaccination rates right around the country. How's that tracking now? Where are we at in terms of double vaccination and booster rates at the moment?
Well, our double vaccinations really good for the 16 and older. Depends on the state when you're looking at the 5 to 11-year-olds, but above 16, we are now, sitting at that 95%, 96% mark for those who've had at least one dose and not far off that for two. For our booster doses, we're sitting at around 60%. So it is important. Again, it varies by state and it varies by age. Fortunately, the people who are most vulnerable have higher rates. We have very high rates above 70%, but we need those to be as close to 100% as we can get them, because we know that in Victoria's own data showed that risk of death, particularly for those most vulnerable to serious infection, is 66% reduced if you've had your primary course, but 88% reduced. So a big reduction, nearly 90% reduction if you've had your booster. So that's the real message, is to really encourage everyone to get a booster, but particularly those who are in those groups, either from their age or with other conditions or treatments they're on that do put them at that slightly higher risk of serious illness resulting from an infection.
And how do you expect the outbreaks to play out over winter as we get closer to that? And what does it mean if we have other viruses, the flu, for example, circulating at the same time?
Well, if we still have the same variants that we have for COVID, we do expect overall there to be a mix of symptoms over winter. So that can make it harder to identify whether you might have COVID, whether it's the flu or whatever. Flu vaccine is going to be important this year for both young and old in particular, but for everyone really, because we haven't got the same natural protection that we would have if we'd had our regular flu seasons over the last 2 years. It may be that you get the flu before you get Omicron. And in fact, if you have the flu, that boosts your immune system generally. And so you might be less likely to get Omicron over winter. So we're not expecting it to be additive necessarily, but we now have increasing likelihood of that exposure to flu with our borders open now internationally and or Omicron. And we still have colds and things circulating that will confuse people in terms of having symptoms and probably, hopefully, encourage people to still get tested if they've got symptoms just to rule out COVID or flu. For those particularly who will benefit from early treatment with antivirals that will help keep flu or Omicron, diagnosed early, that can keep them from becoming very unwell. So we always see more illness from respiratory illness over winter. That's the time where people are indoors, they're mixing, it's more humid, that can help the virus spread. So we expect to see that. We're just not quite sure what the mix will be when we have COVID and flu competing in the same populations over winter. So that's where both flu, vaccination and the booster will help, even that out and hopefully reduce the overall number of people we have with serious illness from either.
Let's hope so. It could be a tricky few months ahead. Catherine Bennett, always appreciate you sharing your expertise with us. Thank you.
Thanks, Ash.